The diarrheas that we worry about are the ones that are persistent, that are waking you up, that at night, that are accompanied with blood, weight loss, and I think that's again not helpful because we are actually killing our friendly bugs every time and we are unnecessarily increasing the resistance.
Diarrhea is not just a symptom, it signals deeper issues like infections and poor sanitation that affect communities globally. Despite being common, many suffer in silence, unaware of its causes or how to prevent it. Dr. Saad, could you explain the primary causes of diarrhea, including both infectious and non-infectious factors? How do these causes vary between different age groups and regions?
So if I was to divide them into benign on not so harmful diarrheas, you get them, which are non-infective, would be what we call irritable bowel syndrome, diarrhea type or diarrhea and constipation combined. Most important symptoms that I've already mentioned are crucial. You must not ignore those that I've just mentioned. Other than not harmful causes, you can have infective depending on where you live. In Pakistan, for example, food poisoning is very common. As summer approaches, a lot of ice and juices are consumed, and again the water is contaminated, and you end up having a bacterial or parasitic infection. Those are the main causes of diarrhea, infective-wise. The diarrheas that we worry about are the ones that are persistent, that are waking you up, that at night, that are accompanied with blood, weight loss, or low blood count. These are things that require investigation and must be treated immediately, or investigated and treated immediately.
What are the common symptoms and complications associated with acute and chronic diarrhea? How can individuals differentiate between a temporary bout of diarrhea and a more serious underlying condition?
So acute diarrhea is mostly infective, and acute diarrhea is mostly self-limiting. So in more than 80% patients, the diarrhea will settle in 24 to 48 hours. It's very important to understand the diarrhea will only harm you if you don't replenish yourself with salt and water. For that, you need to take ORS. If someone has diarrhea and is not vomiting, all they need to do is drink plenty of ORS, or you can actually make, you can put sugar, salt, and lemon and water, and make a drink, and that becomes a little bit more tasty. But then you replenish. You need to have sugar for the salt to go in to your, to be absorbed. Acute diarrhea, as I said, if it's accompanied by fever or if you're vomiting, then you need to go to the hospital. Most acute diarrheas, you do not need to use antibiotics, which is what we do here. And most acute diarrheas are not viral. So hence there is no point using flagyl in all patients, which is what metronidazole or flagyl, which is used very commonly by people even before they go to the hospital or get in touch with the doctors, and that's a practice that should be avoided for the reasons that I mentioned about the microbes or bacteria that we have, friendly bugs that we have in our gut. Now, chronic diarrhea is a different thing. Chronic diarrhea can occur again because of simple or benign disease like irritable bowel syndrome. Chronic diarrhea can also be because of inflammation in your gut, because of certain infections, TB, and so chronic diarrheas must be investigated and must be treated differently. But as far as acute diarrhea is concerned, as I said, for most people, fluid replacement is what is required.
Can you discuss the current treatment options for diarrhea, ranging from over-the-counter medications to medical interventions? Additionally, what are the recommended home care practices for managing symptoms and preventing dehydration?
See, in Pakistan, we have generally, we don't like taking a very simple medicine called loperamide or Imodium. And the reason why we don't take it because we used it in children many years ago, and that caused issues and deaths. It's not safe in children, but it's safe in adults, and it's available over the counter almost all over the world. When you have diarrhea, acute diarrhea, the best thing is just to take 2 capsules of Imodium and then follow it with 1 capsule after every 1 or 2 stools, and you can take up to 6 a day. And great majority of patients should settle down with just this simple over-the-counter available medicine. Majority of acute infective diarrheas do not require antibiotics. And I think that's again not helpful because we are actually killing our friendly bugs every time, and we are unnecessarily increasing the resistance against the antibiotics of the bugs that cause these diarrheas. So this is best avoided. I have already discussed the use of ORS or homemade remedies. The most important thing is to understand that diarrhea will only harm you if you're not going to take fluids. If you're not able to take fluids and you're having diarrhea, it's best to go to the hospital and get IV fluids or whatever if you can't take it orally. But you must understand that diarrhea causes dehydration, and that's what kills people.
What preventive measures can individuals take to reduce the risk of developing diarrhea, particularly in areas with limited access to clean water and sanitation? How important are vaccines, hygiene practices, and dietary choices in preventing diarrheal diseases?
Okay, well, vaccine is easy because for those who live in an endemic area like we're living here, there is no real advantage of taking vaccines for really anything, any diarrheal illness. What precautions? I think one of the most important things is to boil water. If you have filter available, I still feel filtered water is best boiled and then have. Then you should have it. If you're going to eat out, then I think the things that, especially in summer, seafood becomes stale very quickly. Watermelon is excellent in summer, but you have to be careful. It goes bad very quickly. The things, if you are having diarrhea or if you're traveling to Pakistan, I think the things that you must avoid are ice cubes where we are not sure whether they are from boiled water or not. Second thing is salads and the special sauces or chutneys and yogurt that is given with barbecue food. So these are the things that are best avoided. Especially summer, it's best not to have seafood outside. I'm talking about outside the house. Inside, again, at home, one should eat anything and everything as long as you know that it's fresh and you've made it. The other thing that I think is very important is that even otherwise we are now using a lot of fast food, lot of food outside, which is not good for our health and not good for our gut. And I think the new generation needs to take a step back and stop this habit of eating food every other day outside or asking for home food, because one of the issues that is not directly related to gut and related to food intake is weight increase or obesity, which is on the up in the affluent society, so we need to be careful. Other than that, I think you should eat and drink everything that you tolerate. There are certain people who would have diarrhea because of milk, and then if they have milk intolerance, they need to avoid milk. If there's a particular food that you eat and you have a problem every time, then it's best to avoid it. But other than that, you should eat and drink everything that's healthy.
As we wrap up our documentary, Dr. Saad, do any a final thought to share?
I think the main message to people would be to live a healthy life, take healthy diet, and in our country where water is an issue, clean water, I think it's best that we should boil water at least and have it. We should not ignore symptoms that I have mentioned. Go to the doctor straight away so that we can pick diseases early. We can treat a lot of diseases, including cancers, if we pick them early. If we don't pick them up early, then unfortunately we neither are able to treat and the patients suffer. So to me, look after yourself. If there is anything new that you're not sure of, just go and see a doctor.
As we conclude, it's clear that diarrhea is a global challenge highlighting gaps in health, hygiene, and education. However, with simple prevention and advanced research, we have the tools to make a meaningful impact.